Welcome everyone to this webinar on health. As anyone who listens to our webinars knows, we are absolutely passionate about the intersection between physical, financial, and mental health and well-being. And today we have a wonderful panelist who's going to talk to us about how these are inextricably linked. But before we go further, let me acknowledge that I'm coming to you today from the lands of the Wurundjeri people of the Kulin Nation, and I pay my respects to their elders, past, present, and emerging. So without further ado, let me hand over to our wonderful director, Anna, who will introduce Joseph, our panelist for today.
Thanks so much, Vinita. And on our panel today, our fireside discussion, I'm really excited to announce our guest, who is Joseph Healy, co-founder and CEO of Malu Health, and previously the co-founder and CEO of Judo Bank. Now, Joseph, I might hand over to you to introduce yourself in more detail to our audience who perhaps may not know either Malu Health or Judo Bank. So please, thank you so much for being part of this discussion, and please tell us a little bit more about yourself.
No, it's a great pleasure to be part of this discussion, and thank you for the invitation. My background has primarily been in banking and finance, both in Australia and overseas. I worked for the large banks here in Australia, two of the large banks, and then in 2016-17, together with some others. We created Judo Bank, which is a bank that special focuses in on the small to mid-sized business economy. And that the reason for launching a new bank was to address what we saw then as a market failure, and the banking system wasn't really looking after small and mid-sized businesses very well. And then I was the CEO of Judo Bank until 2024. And at that time, I wanted to dedicate uh, the next 10 years of my career to mental health. Now, moving from banking to mental health is a big jump, and no doubt we'll get a chance to talk about that. But again, I saw a failure in the way that the system was working and dealing with the growing demand for mental health in Australia. And so using my skills and experience in building and managing businesses and creating things, I felt there was something that I could do in the mental health area that could help make a difference. And together with other people, we have built Malu Health Group. Now, my background beyond my career is I've had a lifelong passion for learning and education and learning, which resulted in me completing six master's degrees, including, from financial economics and two degrees covering China, contemporary Chinese studies, and then a master's degree in psychology and neuroscience of mental health, which helped better educate me on the landscape around mental health. And just finally, in addition to that, I've authored five books. One co-authored with a good friend, David Honry, on called Black Belt, which is all about building a business. But most recently, a book called What Would Adam Smith Think of Modern Australia? And most of your listeners might say, well, who is Adam Smith? And Adam Smith is the widely acclaimed as the founding father of modern economics. He lived almost 250 years ago, but the way that economics has evolved and exists today owes a huge amount to the philosophies and insights and wisdom of Adam Smith. And I felt that in a world, and this plays into mental health, in a world where, on the one hand, so many things are going well here in Australia, our economy is one of the strongest economies in the world. It's been slowly slowing down quite a bit in recent years, but still relatively so a very strong economy. But there are so many things about our society, as distinct from our economy, that are quite concerning. And Adam Smith argued that a growing economy should go hand in glove with a prosperous society. Society, in other words, society well-being should mirror the economic well-being. Now, they become disconnected. In fact, I would argue they've become divorced. And so when you look at societal well-being, there are some quite concerning trends. And so, for example, we can talk about the Australia's got a huge problem when it comes to gambling. And of course, that gambling is associated with a whole range of other societal problems. It has a huge problem when it comes to rise in domestic violence and divorce rates, in family dysfunctionality, in crime rates, which continue to grow, in drug and alcohol abuse, a growing, growing gap between the financially well off and those that are not, both in terms of wealth and income. And we see that in the housing market, how difficult it is for people to get into the housing market. And then, one in seven Australians are on some form of antidepressant medication. So when you look at that scorecard of societal well-being, it doesn't paint a particularly good picture, even though when you look at the measures of economic success, we see a more positive picture. So Adam Smith really highlighted that these two things should go together, and they're not going together. And the book tries to draw lessons from what Smith saw and believed, and how those lessons are relevant to the world that we live in today, and how, in many ways, to think about addressing some of the problems that we face in society, going back to the fundamentals of what Adam Smith had to say is a good place to start. So that's a big plug for my book, What Would Adam Smith Think of Modern Australia? But it's hugely relevant to financial well-being and to particularly to mental health and mental health well-being.
Fantastic introduction, and there's so many interesting points there. Obviously, you're very qualified to talk about a number of topics, and it's interesting to consider, the learnings that you would have from setting up Judo Bank and, working with that space with business owners and the challenges they face as well. And then this transition to focus more on mental health. And I really like that tie in with, you can think about economic success, but that's one thing to be doing well in that space, but how does that actually translate to how people are feeling and how society is going? Um, is there anything else? I mean, you've spoken about Malu Health to an extent, but do you want to tell us a little bit more about what led you to start Malu Health or any of the learnings that you've had so far?
Yeah, I mean, a long-term interest in mental health. You know, I can remember not that many years ago when it was somewhat of a taboo topic. People didn't talk openly about mental health. Thankfully, that has changed. There are still some communities and some cultures, and actually, I'm thinking here, and being very general in my remarks, we're thinking here about men. That there are pockets of our communities that still feel somewhat hesitant about to talk about their mental well-being. So I had a long-term interest in it. I also had a lived experience in that a number of years ago, I had a I have a son, I should say, who was suffering from mental health conditions, depression, anxiety. And trying to navigate the mental health landscape to get help for George was very frustrating, really frustrating. And I just felt that experience, and having listened to others who'd tried to navigate the system, it just struck me that there was a problem in the way that we were delivering mental health care. And something needed to be done because the mental health problems, unfortunately, are only growing in our communities as they are in other parts of the world. So my remarks, of course, are about Australia, but I don't want to suggest that Australia is unique. These issues that we are grappling with are very common in other, particularly, I would say, Anglo-Celtic cultures. I'm thinking about Britain, for example, and the United States. But anyway, I struggled to navigate the system, and unfortunately, and it's 5 years to this month that we lost George, and at the age of 24. And when I think back about, I'm not suggesting that a different outcome might have occurred, but getting the help that we needed for him was an underwhelming and frustrating experience. So I felt that there was something that needed to be done here. As I mentioned earlier, I felt that I had skills and experience in building businesses and organizing and managing. I have a natural talent, must be a better word than talent, but a natural inclination to think about the future, to build a vision for what is possible, and then to build a strategy, create a vision, and to build a strategy that supports the execution of that vision, taking a longer term view. Not a great person for quick fixes. I think that problems, real problems in life, be they personal or business or societal related, require serious thinking and serious planning and serious organizing. A measure twice, cut once approach to doing important things in life. And so I felt that I had skills that I could employ in an area of our community being mental health that I cared deeply about. I was deeply concerned about just how poorly organized the system is, both in the public sector, which in some parts of the country is totally broken, but in the private system, where the clinicians around the country are working very hard, but totally overwhelmed by the demands that's been placed on them. High burnout rate, which worries me, that you get people leaving psychology in particular at what I would describe as the peak of their professional life, and that age of 30 to 45. I mean, that peak can go on for a lot longer than 30 to 45, but you know, people leaving the profession because of exhaustion was a concern. So I felt there was and then the propensity to medicate, was one of the ways in which the system copes with the demand that's being placed on it. Is I believe, and I'm not alone here, that there's a too easy, a convenient propensity to medicate for things where medication may not be the right approach. And sometimes medication is administered, and there are consequences, unintended consequences of reactions and long-term impact on people's well-being. So, without in any shape, manner, or form holding myself out as a medical professional, I do believe that I have skills and experience that can help make a difference. And I say that also to include my colleagues that are working with me on building Malu. We're very excited about this. It's, in life, when you're doing something that has a strong sense of purpose, where you're actually adding something back, that's a great sense of satisfaction, particularly when you've had a long career in in another sector, which has helped. Of course, banking can and does help people, but not in the same way that where the medical profession does, and mental health being a part of that medical profession. So a very clear vision about building Malu Health into, and I say this without hesitating, into a world-class mental health company. And I say that having researched mental health extensively over the years, and back in late 2024, I toured 9 countries in Europe, visiting their mental health clinics and hospitals, speaking to the academics that focused on mental health and worked with the health community, speaking to policymakers and investors. And I got a very good sense for how different countries were coping with the surge in demand for mental health care. I didn't visit the United States, but I did what I would call desktop research on the state of the sector in the US. And a product of all of that research was a strong sense that we could build something in Australia that is genuinely world class in the way that it takes care of the community. And one of the things that's quite important to me and my colleagues when we think about Malu is that we place Malu, if I can talk in the context of strategy, the strategy for Malu is very much a clinician-led strategy. So when someone says, well, who are your customers? As is a legitimate question in any walk of life. Uh, in my mind, Malu, the customers, in inverted commas, of Malu are the clinicians. And so if we build an organization that allows the clinicians to do what they do well, that gives them greater job satisfaction and invests in their learning and development, that genuinely cares about their working conditions and how they can be engaged and excited about helping their patients or clients, then that's the kind of organization culture that we want Malu to be. And we want high standards of clinical care. And we want an environment where people are learning, because one of the things that concerns me when I think about mental health, but I could say this true of a lot of professions, is the need to stay up to date with research, with developments in your profession, and having a global view, not a necessarily just a narrow domestic view, but thinking about what's happening in mental health research in Europe, in the United States, in Asia, and then staying ahead of what is quite a fast-moving field, much more so than physical health. I mean, physical health continues to evolve, but mental health has always been, in many ways, the poor cousin when it comes to the broad health sector. And a lot of the physical illnesses that we grapple with today have been subject to extensive research and success over decades. And that research and innovation, if I can use that term, continues. But mental health is a much more underdeveloped field than physical health. And that plays back to a sense I mentioned earlier that mental health in the health sector has perhaps been seen as a poor cousin. And so that's something I care about a lot, and helping mental health professionals, grow and develop as individuals so that they can continue to do their very best to help our communities. I feel very strongly about that.
And you mentioned that there's sort of a culture of burnout and, challenges to retain quality or, professionals who should be at the peak of their careers. Are there any other, or what else do you think holds the sector back from being more effective or more, supporting the needs of mental health in Australia? What could be better?
Well, I think the sector is under-resourced. It needs a lot more investment. But I say that, and then the pragmatist in me says, well, that's an argument that lots of segments of the health sector I'm thinking about education sector would argue a similar problem. Where I think mental health is particularly challenged is that it's set up as what I would describe as a cottage industry. So in Australia, there's about 35,000 qualified psychologists. There's about 4,000 qualified psychiatrists, and there's about 3,500 clinics, mental health care clinics across the country. But the vast majority, and by that I mean well over 90%, are actually very small clinics with two or three or four clinicians. So hence the kind of cottage industry. So if I think about the makeup of the mental health sector, I think I see 3,500 what I would call small businesses, like two, three, four, five people working. And so I think the sector is poorly structured to provide the care that society now needs and demands. And that's why in Malu, we're a big part of our whole strategy is what I describe as a scale and scope strategy. And by scale, I mean bringing together a lot of these smaller clinics and building and creating a larger clinic that allows for greater investment in technology to make life easier for clinicians, greater investment in learning and development so that they're growing as individuals, greater investment in their own work-life balance. So these are things that you can do as a bigger company, which are harder to do as a kind of sole proprietor style operation. So I think the structural makeup or design of the sector is not fit for the demands that are placed on it today. And the big part of the vision we have for Malu is to build a company with 100, and is within the next 3 to 4 years, a company with 100 clinics around Australia, predominantly certainly in the next couple of years on the East Coast, but we will go to the West Coast and other parts of the country. But building something that's got the benefits of scale and scope. And by scope, what I mean access to specialization. I'm a great believer in specialization. It's very common, of course, in medicine. You go to see a GP, and he or she will sometimes pass you to see a specialist to address whatever condition you may have. In mental health, there are, of course, lots of different uh, um, mental health illnesses, uh, from child mental health, sleeping disorders, eating disorders, depression, anxiety. It's a whole drug and alcohol abuse or addictions more generally, and the list goes on. So we want to make sure that we have specializations within Malu that when someone comes into a Malu clinic and he or she is diagnosed with a particular condition, that he or she can then see the specialist in treating that condition. Now, quite often in mental health, there's what the medical people call comorbidity, and that is that quite often there's more than one underlying issue. Sleeping disorder might be the problem that you're dealing with, but the underlying cause of that sleeping disorder could be a multitude of things, and not necessarily just one thing. So getting the diagnosis properly done, and AI I can see in the future playing an important role in helping improve the accuracy of the diagnosis of an underlying mental health condition. So I think, and access to AI and access to technology and access to all the resources are very hard when you're a small business operator. A lot easier when you're part of a bigger organization that has these resources, and including specialist experts such as technology professionals inside the company. So I think a long-winded answer, Anna, to your question, but I think the structure of this sector is poorly set up to deal with the demands that have been placed on it. And that is a big factor in causing the burnout of the professional people in the sector that I mentioned earlier.
That makes a lot of sense. And you mentioned this cottage setup where there's lots of small clinics, and I can't help but notice the mention about small businesses. And as the founder of Judo Bank, that's something that's very interesting to me. I'm very passionate about financial services. I'd love to know if there are any learnings that you've been translating from Judo Bank to Malu Health, or even just in how you've set up the organization, or how those financial services learnings translate to this field.
Yes, and lots of lessons. Look, when you're building a new business, I'm a great believer in doing your homework thoroughly. I mentioned earlier, measure twice and cut once. Plan carefully. Think through the risks, and think through how you would manage those risks. think through the culture that you want the organization to grow into. And this is really important. Um, Often underestimated by people in business, particularly when the people are starting new businesses. But ultimately, the success of any business is defined by its culture more than anything else. And central to the culture are the people that you have working with you. Take great care in in assembling a team. I'm a great believer in the importance of a team over the importance of an individual. Quite often with new businesses, uh, it's the entrepreneurial drive of a strong individual that galvanizes and builds. And that's great to a point, but sustainable success in a business is the product of a strong team more than it is a product of a strong individual. And so assembling a team with complementary skills, with common vision, a passion for building something with a strong sense of purpose, uh, really, really important. And the other thing, and technology, what sort of technological framework do you want? What is the role of technology in the way that you run the business and the way that you look after your customers? These are all general principles that are hugely relevant to starting a bank as they are to starting a mental health company. I do believe that all the big mistakes that businesses, particularly new businesses, make in life are made at the beginning, early on. And when you make mistakes early on, if you deal with them quickly, then the implications of those mistakes are manageable. But if you don't deal with them quickly, then the implication of those mistakes can be quite defining to the future. So measure twice, cut once, careful planning, think through what are the human skills and culture that you want in the organization? What sort of technology? What problem are you seeking to solve? In building a new business, you have to be clear on what it is you're seeking to do that is missing from the market today, and in building your business and developing your strategy, what is it that's going to make you successful compared to those already in the market? And then what sort of capital do you need? And I leave that to last, and that's counterintuitive because a lot of people that I speak to, and I speak to entrepreneurs looking to build businesses on a regular basis, and they'll often call me and say, "Look, can we have a coffee? I've got this idea I've been working on, and I need to raise $10 million." And I say, "Well, hold on. There's a lot to go before you get to the money. The thing's got to work. It's got to address the points that I mentioned earlier." And then you say, "Okay, there's a clear market problem. There's a clear market opportunity. This is how we will build our business to make a difference. These are the resources, including people that we're going to need, and the culture that we want. And then we're going to need money. And it's not just a question of money to get the show on the road. You've got to paraphrase Stephen Covey, you've got to start with the end in mind. What is it you want this to look like in 5 years' time? And then make sure that the capital and resources that you're thinking about at the beginning have 5 years in mind, not the next 5 months. So the approach to building Judo Bank and the approach to building Malu are very, very similar. Good lessons. Always in life you're going to make mistakes. Uh, in my experience, those mistakes are so often around people that you bring someone into the organization early on because he or she may have skills that are relevant, but they culturally are not a good fit. They're not team players, and building a team requires a strong social connection, between the individuals, that they trust each other, they work well together, they communicate well, and they back each other up. And sometimes you might find that some of your early selection of people can be quite a headache for you because they don't demonstrate those attributes. Wonderful CVs, and that I've never hired anybody that hasn't had a wonderful CV. But the proof of the pudding is in the behaviors, in the values, in the team dynamic of the individuals. And my big word of caution, strong advice to anybody building a business and building a team is be really, really, really careful on the people that you bring into the team with you. That the old saying of one bad apple. A rather long-winded answer, and hopefully not too, hopefully some interesting insights in that.
No, absolutely. And I can really see the lessons that you've learnt from establishing Judo Bank, but also how that translates to Malu and also how it translates to kind of broader organizations generally. I think your
Yeah.
quote, sustainable success in a business is the product of a strong team rather than a strong individual. I think that's really profound, but also very true. And I'm sure anyone who has worked in an organization can attest to the fact that team culture can be going really well and then suddenly it shifts. It can go off balance just from personality clashes or, misalignment of vision or people working for different reasons. And yeah, it's interesting just how important people are to actually executing the tasks or the goals of the organization effectively and how, sensitive that balance can be. So that was a great answer to my question. Thank you. And something that Vinita and I have had many conversations about is, the relationship between financial health and mental health and, how that all ties together. Do you have a view on this? Is this something that you've seen, particularly working with business owners, but also, as your learnings across, mental health as a field?
Oh, yes, I do. I have very strong views on this. I mean, my banking background has means that I'm deeply familiar with the importance of financial well-being and how that can link uh, and trigger all sorts of problems if that well-being is not where you'd want it to be. I mean, we live in a country, a rich country. But we also live in a country where the level of debt in what I call the household sector, or the level of debt that people have, that's distinct from businesses, is the second highest in the world. I mean, we have an economy of around about $1.7 trillion, so GDP. We have debt in the household sector, largely in the form of mortgages, close to 2.5 trillion. It is outside Switzerland, it is the most indebted country in the world when it comes to, normal family homes. A lot of that, of course, is because of our love affair with property, not just property to live in, but property to invest in. All of that, on the one hand, might be a good thing, but living a life where you're up to your neck in debt and for over 50% of your disposable income, and this is a statistic which is true of Australia, where over 50% of average disposable income goes on a mortgage. That is, for me, is a real worry because the number of people that will be lying in bed at night worrying about how they can make ends meet. Can they afford to put, with rising food prices, rising energy prices, mortgage rates climbing again, that puts a huge burden on individuals. And that, of course, can lead to coping mechanisms such as alcohol, gambling, and drugs. It can lead to just anxiety and stress which creates its own problems because we know that a major cause of family breakup is linked to financial problems. So I see these things as very interconnected, and I see that in a world where we are very much a dopamine nation. Dopamine is the neurotransmitter, the chemical in the brain that provides deals with the enjoyment, satisfaction neural pathways. And people look for these dopamine shots to kind of make them feel good. And that might be buying the next fancy thing that's on the market, or buying a new home, or buying a second home. So it's this instant gratification or short-term gratification, and a sense that we haven't had a recession in this country for well over 30 years. And the memory of when things can go wrong, and the impact that can have on families when there is a financial crisis, at a domestic, if you lose your job, for example. So I think these are all very connected, but in Australia they're connected particularly because of the high level of debt and credit cards and mortgage debt that so many people have in order to maintain a lifestyle that we've kind of become accustomed to. And debt can create huge problems that can result in quite serious health implications, but particularly mental health implications.
Absolutely. And it's a good point with how financial health or financial stress can then lead to other challenges, or it exacerbates underlying conditions, or the family breakdown, or just the lying in bed not being able to sleep because of the stress. Stress is such a all-encompassing challenge for many people.
Oh,
And
yeah, and there's lots of research on this, but without wanting to get too off topic here, but there is lots of research on the link between stress and certain types of cancer. I know that in stomach cancer, prostate cancer in men, breast cancer in women, it can vary by. I did quite a bit of research on this, but the link between stress, excessive stress, and physical health, particularly in the form of certain types of cancers, is a well-established fact, and these things are linked. And of course, as I said earlier, one of the ways that people cope with stress and other mental conditions is through substance abuse, which then triggers a whole range of other physical health. So these things are all connected, and I am a great believer in the interconnection between the brain and the body in terms of its well-being. That a lot of problems in the brain are triggered by problems in the body, and a lot of problems in the body are triggered by problems in the brain. And I'm not expert in this, but I am familiar with the research, and I think that we should never lose sight of the interconnected nature of physical and mental well-being, and its close association with financial well-being.
absolutely. And you've mentioned your goals for Malu Health to an extent, in terms of bringing together clinicians and making that network so that there's better access to technology and information, and trying to support or reduce burnout and have that connectedness. Are there any other, or what else are you planning for the future, and what are you excited about when you think about the opportunities with Malu Health and the opportunity for your impact? I know there's lots of books that you've been involved in, and your legacy you're really building, but what are you looking forward to for the future?
Oh, I'm realizing the vision for Malu is the all galvanizing force in my business professional life right now. I'm so confident that if we stay true to our purpose, if we manage carefully, but bravely, that we can build something that can have a lasting impact on the lives of so many, and encourage others. I mean, in my business life, we often talk about who are your competitors, and when it comes to mental health, I don't think about competition. I think about cooperation, because the magnitude of the problem in mental health. Now, Australians spend 2024 spent $13 billion on mental health care. Now, that's a mixture of private money from your own pocket, Medicare, insurance company, NDIS, etc. That figure is growing at 16% per annum. And so by 2030, which is less than 5 years away from now, Australians will be spending $30 billion on mental health care. These are big numbers. And even if those numbers are overly optimistic, in inverted commas, in terms of the projections, and we're out 5 to 10 billion, it's still material. And yet the system is not set up to provide the care that is demanded by the community and is needed by the community. So building something that actually makes a difference, and I would love to see others copy what we do, and I would gladly engage with people and say, look, we've watched your journey, we've seen what you've tried to do, we'd love to do the same. Could you talk us through what went well and what didn't go well, what the lessons that you learned along the way? And there are always lessons you learn along the way. I would love to do that because I think the more people and more resources that are invested in mental health care in Australia is only for the good. It's only for the good because right now the system is not set up to provide the care that our community needs and demands.
I love that point, and it's something that I think comes up a lot when you speak to people in the financial wellness and social impact space, where it's you're not competing. I remember asking a question years ago, who are your competitors, to one of our panelists, and they were like, I don't have competitors because if we're all doing the same thing or if we're copying each other, great, it's more impact. If someone can expand the reach, go for it. It's very different to financial services or business where it's kind of that, oh, they're doing something similar, I need a point of difference. I love the idea of collaboration rather than competition because then you can expand the reach, then you can have a greater impact and share those learnings like you mentioned. I'm sure that fundamentals of a lot of your business learnings from establishing Judo and also Malu Health is things that have, mistakes and lessons and things that work. And if everyone can be collaborating and having that shared vision and sharing resources and knowledge, how much more quickly could change be accelerated?
Yes.
It's such a great point. And yeah, this been such a great conversation, and I really appreciate your time today. I'll hand back to Vinita to conclude our session, but thanks again for just talking through so many interesting learnings from both the business side, the mental health side, a lot of those learnings about culture and organizational change. And yeah, there's lots to think about, but this has been really fantastic. So thank you.
No, thank you, Anna.
Thanks so much, Anna. And Joseph, of course, we are so thrilled to have the chance to talk about some of your insights. I just love the fact that I'm not the only one who's always banging on about the importance of the inextricable link between financial, physical, and mental health and well-being. It was so lovely to listen to your experience and how you firmly believe that the three should be addressed together in a holistic whole. And that's something that we've tried to do over the course of however many years we've been running the Center for Financial Wellbeing. So that is a great insight. I also love the fact, Joseph, that you're a lifelong learner. And like you, that's exactly what I've been doing. And, in the last 5 years, I was in the Psychological Society looking at policy and practice and impact. And you have picked up the issues that we have been constantly advocating for. Absolutely spot on. The majority of psychologists are women working part-time in small, tiny little clinics. And I can tell you, as someone who's currently studying a master's of psychology, nowhere are these women taught about how to run a business. Yet,
Yes.
as soon as they get their APRA registration, that's what they're expected to run in an effective manner.
Yep.
So, that gap that you're trying to fill is exactly what someone needed to fill. And I agree, it's not totally the government's problem to solve, but it's wonderful to see the private sector stepping up to solve this problem, which is not always the case that Anna and myself have seen. So thank you and congratulations for picking that up. And last but not least, as someone who is absolutely passionate about evidence-based policies and programs, I'm so thrilled to hear about your strong support for research and making sure that the ever-changing landscape of evidence-based is able to inform psychology as a science practitioner model, because that is so important. Yet there's not always opportunities for psychologists to do that in addition to managing their own little tiny businesses. So very soon we'll be also interviewing the CEO of a cooperative research center, which is called the Care Economy CRC, Joseph. And that the focus of that particular one is to build the digital capabilities of the healthcare sector. So it'll be so interesting to weave in some of your insights into our following conversation with Carmela when we speak to her about this issue. But I am just so thrilled to hear about the vision of Malu Health Group to be able to scale up and really give opportunities to these clinics to reach milestones that they would individually not have been able to achieve. We strongly believe in the power of collectives, and we know that the impact that you can achieve through collaboration is so much greater than individual impact. So we thank you once again and really look forward to your success. Thank you, Joseph.
Thank you very much.